Hello, Manitoba and the Manitoba Curious. It's Marcy here. Before we get into today's podcast, the final one of the year, I have a bit of a favor to ask. If you aren't already, we'd love it if you could hit the follow button wherever you're listening on whatever app. There's a lot of news to keep up with, and we're keeping tabs on the biggest stories in Manitoba to try and help make sense of what's going on right here at home and what it means for you. So if you are already following This is Manitoba, thank you. And if you do, maybe leave us a rating or a review as well, because it helps us understand what we can do better. And the whole point of this is to help more listeners find us. So we're really grateful for your help in getting the word out. And now, on to today's podcast. The holidays are a busy time, especially for healthcare. We are recording this at about 9:30 a.m., the morning of New Year's Eve. And just looking at the current emergency department wait times at 3 Winnipeg hospitals, it's 9 hours over at St. Boniface, it's 12 and a half hours at the Grace, and it is nearly 12 hours at Health Sciences Centre. Now, those waits are long, but they're not unusual for our province. Median wait times at Winnipeg hospitals have been trending upwards since the COVID-19 pandemic. Wait times as well for several types of surgeries, including hip and knee operations, also increased in 2025. Fixing Manitoba's healthcare system has been a focus of Premier Wab Kinew and his NDP government since the 2023 election. They campaigned on it.
Fixing the healthcare system will be hard work. But you know the way that we do difficult things is by getting through them together. That is the Manitoba way.
And when Wab Kinew celebrated on election night 2 years ago, it played a starring role in his victory speech.
I want to say thank you, because at the start of this campaign, our team made a decision. We chose to believe in you. We chose to believe that given the choice, you, the people of Manitoba, would embrace a positive campaign focused on the future, focused on fixing healthcare and making the economy more affordable, and that you would reject the divisive message sent by our opponents. And I know that the road ahead will not be easy. But there is one thing that the results of tonight's vote show crystal clear. And it is, we can do amazing things when we stand together as one province. We can accomplish awesome tasks when we stand together as one people. And there is no challenge that we cannot meet when we unite as one Manitoba.
The Premier was not wrong. The road has not been easy, and the fix is not a quick one. So this December, CBC Provincial Affairs reporter Ian Froese sat down with Premier Wab Kinew for a year-end interview, just like he does each and every year. And of course, healthcare was on the agenda.
There are still long waits in ERs, long waits for surgeries and diagnostics. When does that get fixed?
This year.
I'm Marcy Marcusa, and in case you haven't yet guessed what the topic is on the podcast of This is Manitoba today, it's healthcare. Ian Froese is in fact here live with us on the pod to walk us through the Premier's latest healthcare timeline and why some people in the field say that they have some doubts that he and his government can deliver. Hi, Ian. Thanks for being with us.
Thanks for having me.
So you sat down in this interview with the Premier. You were in his office. This was in the legislative building. When he says he's going to fix these long wait times this year, 2026, what's your reaction?
I'm surprised because we hear so much from the Premier and his cabinet about fixing healthcare, but there was never a time. There was never a date. Here we got something. It was always just a nebulous, we'll fix it eventually. And, we've been hearing that frequently from this government, including, as recently as November with the Health Minister, Yzoma Seguera, speaking at a paramedic training seat announcement.
The work to turn around the damage done to healthcare, including losing almost 100 paramedics alone in rural Manitoba, doesn't get fixed overnight. It takes time, it takes teamwork, it takes sustained effort. We are moving in the right direction, but it takes time to fix the magnitude of damage that was done. And as the Premier said, we can't thank these folks enough for choosing this calling.
I will get Ian into more of what the Premier discussed with you in a moment, but first, can you walk us through what's behind the long wait times that I was citing as we sort of set up the podcast today?
Yeah, well, there's lots of reasons, Marcy. Not enough staff, not enough beds. We've heard that plenty of times. But the main driver, and we hear this from doctors and nurses, is what's called access block. We have patients in our hospital that are ready to leave. They're ready to be discharged, but there's no place for them. Say a personal care home bed. There's dozens of people in Winnipeg hospitals right now that need that personal care home bed and can't get it, as an example. So then you have all these people that are stuck effectively, and the people who are sick enough to be at the hospital, they want to get transferred into a medicine ward, they're stuck waiting and they pile up in hallways. And until that problem gets fixed, we're not making too much headway on solving this issue. And there's so many, consequences to that. Like, for example, there's, earlier this year we saw a number of between 14% to 17% of patients that show up to Winnipeg ERs leave. They leave without being seen, presumably just frustrated with everything.
And Ian, that issue of people leaving the ER before being seen was really stressful for folks this year. There were people writing to the morning show even saying, last night I was there, I left. So it's a big worry. If we look at another aspect of this, what about surgical wait times? What is behind those waits?
Similar struggles there. We have a growing population in Manitoba and also an aging population. Thus, we need more surgical capacity to handle that need. We saw a couple years ago the former PC government saying that, hey, we don't have enough capacity, so that they created this surgical and diagnostic task force, which increased the number of people that we were sending out of province. The NDP did not like that. Once they came into power in 2023, they disbanded that task force and have put efforts into increasing that capacity here at home. The NDP says they're doing that, but still, as you mentioned, off the top, median waits for a lot of surgeries went up this year.
The Premier is now saying, let's get to his specific promise that, like you, I was surprised as well. It's like there's a timeline here. So he says a reduction in these wait times by the end of next year, end of 2026. What does his government plan to do between now and then to actually make that happen, though?
Yeah, so I asked him that very question, and here's what he had to say.
People have been saying we need more staff. We've added more staff, and we'll continue to add more. People are saying that we need to guarantee the patient experience, the safety for the patient. So we're bringing in a patient safety charter. People have said we need to end mandating for nurses. We're going to start doing that. People have said we need to have staff to patient ratios. We're going to start doing that. We've also done a whole lot of other things in terms of making the hospitals run more efficiently. Great initiative at the Grace, being led by Dr. Dan Roberts. And just by formalizing the way people do rounds there, they've done the equivalent of us adding 17 beds to that hospital. So again, there's a whole mix of priorities of things that we got to do. But when it comes to the resources and sort of the more macro level decisions that government makes, we're taking those steps.
Lots to unpack here, so why don't we do that? He mentions the staff right off the top, right? The NDP government says they've hired 3,500 net new healthcare workers over the 2 years in power, around 1,200 of that being nurses. So he's saying effectively we have the staff that we can make progress on that. He also made a couple of promises in November in his throne speech. One would be a patient safety charter, that he would enshrine that sort of this right to safe care for everyone. He's talked about ending mandated overtime for nurses. This isn't going to start everywhere, but he says it will start in priority areas. Again, we've heard the Premier say we have enough nurses for this, something the nurses union has disputed in recent weeks. And also the start of staff to patient ratios, instituting that, again, priority areas before this gets expanded everywhere.
Now, you've spoken with people also who work in healthcare, obviously. Can you elaborate then on the nurses and others and what they think of this timeline?
Yeah, so let's start with the Manitoba Nurses Union president, Darlene Jackson, who I spoke with.
Well, I wish I was as optimistic as the Premier and the Minister of Health are when they make their announcements and speak on these issues. I am not as optimistic.
Yeah, we've been hearing from Darlene Jackson and the Nurses Union for a while now that they're wondering, where are these staff? Sure, the government says there's been 1,200 net new that have been hired. But when Jackson talks to her members, they're wondering, where are they? Because they're still overworked. They're still seeing staff vacancies. They're still being mandated overtime. They're not seeing a noticeable difference.
Now, we also heard doubts from the Nurses Union coming out of the throne speech, where the provincial government pled to put an end to mandatory overtime for nurses, just to dig in there a little bit more. So what about other healthcare workers? What did they make of the Premier's promise on that front?
Yeah, so I spoke with Jason Linklater, head of the Manitoba Association of Healthcare Professionals, and here's his reaction.
I actually have a bit of confusion with the response. There seems to be some extreme confidence, but without the substance that I think is necessary to make statements that the healthcare system and wait times and surgical wait times are going to be fixed this coming year. I have real concerns that the numbers don't align with a statement like that. We continue to see emergency room wait times that are far too long. We see surgical wait times, diagnostic wait times, and we see paramedic call times still too protracted because of a staffing crisis that we have. And so there is a huge amount of work that needs to be done before I think statements can be made like we are going to see that fixed in 2026.
So again, they're scratching their heads as well, wondering, frankly, where are the staff to ultimately reduce wait times? And we've been hearing from this union for a while now. They're wondering, where's the healthcare staffing plan? They see targets from the government. They say a number is nice, but what's the strategy to actually get to that number?
So I guess my question is then, where sort of is this all originating from? Where is it coming from? What do the people that you spoke to have to say about, maybe why the Premier is making this claim now and putting this timeline on everything now? And because he sort of came out hard at the end of the year here with things.
Yeah, and it was such a marked difference from what we've heard from the Premier before. And this came up in my conversation with Darlene Jackson, with the union president. She thinks that these claims are being done for political reasons. And here's a little bit of my exchange with her.
I think that politically they need to say that, but the reality is we're not seeing that on the front line.
Why do they need to say that politically? Because they've said for years that fixing healthcare will take a lot of time, and to say that next year is the year that long waits will come down noticeably. Why does he have to say that?
Well, because they were elected on a healthcare platform, fixing healthcare, right? They were going to fix wait times, all of that. Those issues were going to be fixed. And everyone realizes it's not an overnight fix. You can't build a nurse in, a year. There's a wait for that. And even opening more nursing education seats is the long game, because it takes 4 years for a nurse to finish their education. So it's, I think politically the government needs to say we're making progress, and we're because they got in on a healthcare platform. But what nurses are saying is they're not seeing that reflected on the front lines. And, the great example of our post from last week, where a nurse, and I was actually at that MFL education day when I saw her go and speak to the Premier. And then she came over to see me, and she was almost in tears and said, I have never been so disappointed in my life. I'm trying to explain how I, as a frontline worker, see issues happening and understand how they're going to stop mandating when, what all it means is that we're going to either work short all the time or even shorter, or what's going to happen is nurses are going to be guilted into working overtime. And we call it voluntold rather than volunteer. And she said it's not going to happen. And she felt like she was absolutely disrespected giving her opinion as a frontline worker. And I think that for nurses, but that's part of the culture shift we're looking for, right? Is the frontline is the expert on what's happening in healthcare. And when you try to explain to a politician or someone that is not involved in healthcare what the issues are and get brushed off, that's part of our whole culture issue, is that no one's listening to the people that we consider the experts on the front line. And I was so disappointed when that happened, because she said I voted for him, and I actually lobbied people and advocated for people to vote for this government, because I truly believed that healthcare was going to be number one, and I don't feel that way anymore. So it's incredibly disappointing.
While progressive conservative health critic Kathleen Cook believes the government is just trying to persuade people that things are better, even when they aren't.
I think he's starting to feel some pressure now, because his government's been in power for 2 years, and they've been unable to keep the promises that they made during the election. And in fact, things are moving in the wrong direction. ER wait times are at record highs. Surgical and diagnostic wait times are higher now than they were 2 years ago. They failed miserably in their promises to hire certain frontline healthcare professionals, for example, paramedics.
So it's interesting, Ian, as we get to sort of wrapping the podcast today and looking ahead to the new year, you know that I have the Premier in here every month, and I tried to ask him some of the same things that you did, especially the thing that's really sticking with me is the mandatory overtime. So he kept continuing to say, look, we put in part one, it's the people, now it's part two. And he kept going back to feeling that it's managers that have to manage the people differently to be able to fix some of these big issues, in our system. I guess we'll see. What are you going to keep an eye out for as we move forward and the NDP pursues this promise next year?
Frankly, I mean, can they deliver? Can they fix the issue in healthcare that people would largely argue is the biggest issue, that the long waits,
the wait times,
years for surgery, hours to see an ER doctor. Admittedly, we don't have any metrics, right? So we don't know what might be considered a fix or what the Premier does. But
what success is, yeah.
Exactly. We will keep an eye on that. And also, as we've heard from Kathleen Cook and Darlene Jackson, that messaging, I'm going to be really interested in that, because again, they kept saying we're going to fix this. It's going to take time. Now we hear we have enough nurses, which, if you look and read and listen to some of the news coverage out in Manitoba, that's not what you hear from nurses and people on the front line, is that we have enough. But he says we have enough to end mandatory overtime. And now he's saying we have enough staff to, make significant dents.
It's that whole shift, right? Where you come in as a new government and you're like, this is a big problem. And then the population presumably says, okay, we know, we'll give you some time. But then where will that change, or will it change in 2026? Where all of a sudden they go to, we can't say that anymore. Now we're going to start, as you would have said to me before, patting ourselves in the back. Look what we've done, which would maybe more align with the thinking that they're going to shift into political mode.
Any government of any stripe, they want to say they've had success.
Yeah.
And we're starting to see that shift in healthcare.
So we'll see how they'll measure it in 2026. Super appreciate your analysis, and remind us when the next provincial election is.
Scheduled for October of 2027, and we had the Premier say for 2026. He's not thinking about it at this time.
So he's saying that it's not political. He's just looking at the system. We'll see. We'll be able to measure that all by the end of the year. Thank you for being here. Happy New Year to you.
Thank you. Happy New Year to you as well.
So that is all of us waiting to see what happens in healthcare in our province next year. Happy New Year if you're with us on the podcast today. That is it for this week. I will be back with the one for the new year. It is the first new episode for 2026. I'm Marcy Marcus, so thanks for listening.